People say to me all the time, who cares, Deb? You know, I'm really smart, I'm an engineer, I'm an attorney, whatever that is. Why do I need to know this stuff? And what we know, we have several statistics, but 80% of people in an organization leave their jobs because of their boss. Now, that's not because their boss isn't smart enough and doesn't know as much as they do. It's because their boss does not have relationship skills. So let's look at a small example of that. In the course of the 10 years that I've been working with emotional intelligence, and actually 45 years that I've been working with people in all different ways, what I do is I look for research. I look for anything that factually backs what we call soft skills, because that's a lot what organizations look for. So one of the pieces of research that I ran across, and I use all the time, is about dentistry. Now, a dentist is usually a solo practice, but if you think about a dentist is connecting with people all day long, or they're not connecting with people all day long. So the research says that it doesn't matter if you come out clinically at the top of your class. You will still not be able to do a business if you don't have emotional intelligence skills. It's a really good example of a small business, be it a lawyer, doctor, dentist, counselor, therapist, physical therapist, that has to know how to deal with people. All right, so let's take it a little bit bigger. Let's look at a city government organization. The organization that I work in right now has a phenomenal leadership program on all levels of the organization. What it really does is it improves relationships, which improves productivity. It helps people be mindful and self-aware, which nowadays is a really important concept, because if I'm mindful about who I am, I know who I am in the world around me. So they learn that skill. They relationship build, and then what I love probably the most is they learn how to do empathy. If you put all those pieces together, you have a higher functioning government, you have a government that makes decisions better, you have a government that steps up when it needs to step up. And the city does this. The city that I'm working with does it. It's better. Let's take it even bigger. I work with national healthcare systems. So specifically, I go into hospitals and I go into administrative areas, and I have worked emotional intelligence with CNOs, with CMOs, chief nursing officers, chief medical officers, and sometimes chief operating officers, male and female. And I've talked with them and taught them how to be more emotionally intelligent. So I will take a woman who is on a floor managing 15 nurses, right? And what we know based on employee engagement is that those nurses don't like her. They think she's defensive, they think she's judgmental, and she definitely doesn't build relationships. So I work with her. I shadow her all day. I go to all of her meetings, and little by little, she starts understanding that what's not happening here is why the unit isn't running well. Because the unit would run well if she built relationships. So this particular CNO turned a unit around with them actually saying to her, what did you do? I don't understand this, you're different. And she got to say, I'm learning to build relationships. So take a chief medical officer, and I loved working with them. And I would go into their meetings, okay? Every 17 guys at a table, all with their computers up, their laptops up, and their phones right here. And I would watch this meeting not work. And nobody would get why it wouldn't work. So what I taught them was really simple. Good listening skills, asking powerful questions, and having empathy for the team around you. It took them forever to be able to not do that. But for a month, I stood at the door and collected the computers, and I collected the phones. And the meetings started going extremely well, extremely well. They were initially not pleased with me, but then they actually heard each other. So the big picture is that employee engagement goes up because they're good with each other and they're building good relationships. Patient satisfaction way goes up. So the return on investment is huge. And more patients want to come to a hospital or to a big hospital system because they feel cared about. You can't feel cared about if you're only in your cognitive intellect place. It doesn't work. So it impacts the entire system in a way that retains employees more, lets teams work better, lets patients feel more cared for, and in general increases the value of the institution.